you may need to call for an ambulance. It always helps to have an action plan while we're on our way. The one we're going to tell you about is easy as ABC.
Wow, doctors ABCD actually. Remember to stick to the St. John Action Plan and you too could save a life while waiting for help to arrive.
So let's start with D, danger. It's all about ensuring the area is safe for everyone at the scene. Dangers include things such as electrical wires, gas, fumes or obstacles. If any of these are present, only proceed to help when it's safe to do so.
R is for response. To check for a response, ask the casualty their name or gently squeeze their shoulders. If you get a response, place the casualty in a position of comfort, check and treat any life-threatening injuries and monitor the casualty until help arrives. If there's no response, send for help immediately.
Send, that's what S stands for. Call an ambulance by dialing 000 or ask another person to make the call.
If the casualty isn't responding, then we continue with the action plan and the next step is A for airway. Leave the casualty as you found them, open their mouth and look for anything that may cause a blockage such as the back of the tongue, food or vomit.
If the airway is blocked, put them in the recovery position like this. Tilt the mouth down and clear with your fingers. To open the airway, gently tilt the head back and lift the chin. This takes us into B for breathing. You want to look, listen and feel for breathing. If breathing is normal, keep the casualty in the recovery position. Continue to monitor until help arrives.
Casualty not breathing normally or unsure, then it's time for C. CPR. If you have a face mask, apply this now. Then, find the centre of the casualty's chest, place one hand over the other and compress to approximately a third the depth of the chest. CPR is at the rate of 30 compressions to 2 breaths. Continue with compressions at a rate of 100 to 120 per minute. Keep going with CPR until the casualty recovers or help arrives.
D is for defibrillator. And if there's one available, don't be afraid to use it. Just continue with CPR, turn it on, and follow the voice prompts it gives you.
So, in an emergency, remember the St. John Doctors ABCD action plan.
And you too can help save someone's life. In an emergency, you may need to...
So how did everyone find that? Was that helpful? Yep. Has anyone actually given CPR to anyone or used the AED? No? Yeah, it doesn't have to be a regular thing. Hopefully that you never have to do it, but yeah, it's good to always have it. So, I just want you two guys get into pairs in a few minutes. So what we're going to do is, we're going to go through the doctor's ABCD, and then we'll have a little practice, and yeah, we'll just get familiar with doing some CPR and all the doctor's ABCD. So, like they said, D is for danger, okay? So I want you just guys to get into pairs, okay? And there's some paper floating around here, just in pairs, and just like if you can think of any dangers, just write some dangers, and then as a group we'll just discuss it. So just think of dangers in the hospital, dangers anywhere that you, like if you're going to be the first responder, if you're going to be giving CPR or whatever, what sort of dangers are you looking out for? Everyone got some papers? So just be in pairs. We'll just do this in like a minute or so, and then we'll just group back again, okay? So just think of some dangers in pairs. How's everyone going? So having a bit of a brainstorm? Yeah. Some dangers. So you just think of public places, think of hospitals, just any sort of dangers that you would have to sort of be aware of.
ear dropping.
Okay, how's everyone going? Okay, so what's the pair over there at the end got? Maybe say one or two.
We have codes like wires on the floor.
Chords, yeah.
Yep.
Excellent.
And then traffic.
Traffic, yeah, so if you're out there like at the hospital out there or even in the main road, yeah, excellent. What about you girls?
We had electricity and water.
Yeah, so electric shocks and,
Yeah.
yeah, and spills, yeah.
Um,
Yeah.
we have family members.